So I just want to say a few words about the senator before she has an opportunity to have some words with us. So, Senator Collins is a passionate advocate of home care and hospice, and she is truly a champion of home care and hospice in our nation's capital. She has preserved to ensure that the citizens across the United States have access to our critical services. In fact, she's a leader among leaders, working to place home and community-based care at the heart of our own healthcare system. We are honored each and every day by her service as a tireless advocate for older adults and individuals suffering from chronic illness. Senator Collins works hard to advance policies and legislation to ensure that the citizens in Maine and across the country have access to high-quality home care and hospice services. Her advocacy efforts have included the sponsorship of priority legislation on behalf of the home care and hospice community, including the Home Health Care Access Protection Act, to reform the process of evaluating home health case mix changes, legislation to extend our rural add-on, which is critical for us, and the Home Health Care Planning Improvement Act to allow nurse practitioners, advanced practice nurses, and physician's assistants to sign home health plans of care. And as many of you know, how many of our health centers, our islands, and our rural communities, that's our primary staff that we work with. That's off script. Senator Collins serves as the chair of the Senate Aging Committee and serves on the Health, Education, Labor, and Pension Committee. She founded the Senate Diabetes Caucus and led the effort to more than double federal funding for diabetes research. Most recently, Senator Collins stood up for older Mainers by voting against the deeply flawed health care bill that would have made deep cuts to Medicaid, hurting our disabled, poor, and most vulnerable citizen. It is a tremendous honor to be recognizing Senator Collins with the Alliance's Ruby Slipper Award. We first presented this in 2011. The award recognizes individuals who exemplify the simple phrase, "There's no place like home." When thinking about the presentation for today, I was reminded of the characters in The Wizard of Oz, the Scarecrow, the Tin Man, and the Cowardly Lion. What they lacked are our senator's greatest possessions. She has the brains, the courage, and the heart full of passion. And I'm sure some days in Congress she feels like we're not in Kansas anymore. On behalf of the Home Care and Hospice Alliance and our members, we are blessed with your contributions and honored that you have joined us today to receive the Ruby Slipper Award. So, yes, actually, there's another award, but we didn't have it prepared for today. So, when Vicki and I are in Washington next Wednesday, we will actually present her with the real award.
Thank you so much. Thank you. I think these are the real awards. Well, thank you very much, Donna, for that wonderful introduction. In fact, it was such a nice introduction. I think you should just follow me around Maine and introduce me wherever I am speaking. I am deeply grateful for this prestigious award, and I want to express my thanks to all the members of the Alliance, not only for the award, but for your commitment to bringing quality, compassionate home care and hospice care to patients and families all over our state. I know many of you, I've met with you over the years, and it is you who are making the difference and telling me what to do so that I can help out in Washington. I also want to congratulate the other honorees whom you're recognizing this morning. And I want to welcome Bill Dombey to the great state of Maine. We work together in Washington on so many home health care and hospice issues. The Ruby Slipper Award is truly perfectly named For as Dorothy said, there is no place like home. It has also brought a smile to my face when I saw the name of the award, because growing up, The Wizard of Oz was my favorite movie. And for those of you old enough in the room to remember, it used to come on every single year on television. And I so remember when my family finally broke down and got a color TV. Believe me, it made a big difference. So that's perhaps one reason that I remember the movie so well. Ensuring that people in Maine and across the nation have access to home care and hospice services that they need, however, requires more than clicking our heels together and making a wish. It requires the dedication, expertise, and hard work that bring all of us together today. As the senator representing the state with the oldest median age in the country, everybody in Washington thinks it's Florida, and I always have to say, no, it's Maine. And as chairman of the Senate Aging Committee, I am particularly focused on the well-being of America's seniors. I know how important it is for seniors, as well as individuals with disabilities and with serious illnesses, to be among their family, friends, and neighbors that they cherish. Home health care has proven to be a compassionate and cost-effective alternative to institutional care. Nurse practitioners, physical therapists, physician assistants, certified nurse midwives, clinical nurse specialists, nurses, nurse assistants are all playing increasingly important roles in the delivery of home health care services, particularly in our rural and medically underserved areas of the country. Everyone asks me, why am I so passionate about home care? And I want to give you 3 examples of why. The first dates back to my very early days in the United States Senate. And I was invited to go on a home care visit in Aroostook County. And I really didn't know much about home care back then. This was in, I think it was 1998 or 1999. And we visited a couple who were living in their old homes. They were in their late 80s, and each of them was the recipient of home health care. And I'll never forget the husband saying to me, you know, all we want is to spend the rest of our lives together at home. And it gives me goosebumps even now as I remember his words, because it was the ability to receive home health care that allowed this couple to stay just where they wanted to be, in the security, the familiarity, the privacy, and the comfort of the home in which they had lived for more than 60 years. Moreover, by helping individuals like this couple avoid more costly institutional care, we are saving the Medicare program billions of dollars. I've had this argument with administration after administration about the cost effectiveness of home health care. After all, it costs Medicare $1,932 per day on average for a typical hospital stay. It's $559 per day for a typical nursing home stay. And yet, Medicare is able to get a home health visit on average at a bargain price of $44 a day. So That is slightly more than 2% of the cost of an average hospital stay. Now, clearly there are times when a hospital stay is necessary where a stay in a long-term care facility is essential. But what we're finding is that home health care is increasingly able to meet specialized and complex health needs right at home. And that is what most people want. Donna's already mentioned that I have introduced the bill to extend for 5 years the 3% add-on for home health agencies that are serving patients in rural areas. I'm going to go back to Aroostook County again as my example. Think of the distances that people are having to travel. Now, compare that to 1 block in New York City. Obviously, the cost of serving people in the vast rural expanses of Maine is going to be more expensive just because of the travel time alone. And our reimbursement should recognize that. There's another bill that I want to tell you about. It's the Home Health Planning Act. And this bill, which I've introduced, is bipartisan bill. Virtually all my bills are. That would help to improve access for Medicare beneficiaries by allowing not only physicians, but physician assistants, nurse practitioners, clinical nurse specialists, and certified nurse midwives to authorize home health services. And if you've ever had to wait for a signature from a busy physician before you can begin home health services, you know how important that is. Currently, about 12 million Americans require long-term care services. That number is projected to double by the year 2050 as our population ages. So that is another reason why we need to support home care. I want to give you a second example of why I'm such a believer in the work that you do. A few years ago, one of my dear friends was a patient at the Gosnell Memorial Hospice House in Scarborough. I love this hospice house. I went in to see her several times, 3 times before she died. And I remember one day she said, "You know what I really want? I want scones." And I said, "Scones?" And she said, "Yes, I really have a craving for scones. I love them." Well, sure enough, someone from the staff went out and bought her scones. And that made her happy that day. And being surrounded by family and friends when she died meant that she had the most peaceful, happy passing that you can imagine. And third, just down the street recently in Bangor, died a very good friend of mine whom I've known for my entire life, literally. We grew up in Caribou together. In the last few years, we've been neighbors in Bangor together. She endured years with frontal lobe dementia, a truly cruel disease for this vivacious, vibrant woman. And I would walk down the street and visit her, and each time there was a home health agency providing care for her. And she became close friends with those who are providing the care. And I was talking to her husband after she died last week, and I said how wonderful it was that you could keep Beth at home the entire time. And he said, "I wouldn't have had it any other way." And it made such a difference for her as well. So I am going to close my remarks by quoting an individual who's an expert in this entire field and whom I admire greatly, and that is Dr. Atul Gawande. Some of you may have read his book, which was a bestseller, and it's called Being Mortal. And if you haven't read it, read it. It's absolutely a wonderful book. He is a neurosurgeon by training, but he's done a lot of work on end-of-life care. And I invited him to testify before our committee. And this statement by Dr. Gawande really describes the cause that brings us together today. Here's what he told us. The goal is not a good death. Instead, the goal is to have as good a life as possible all the way to the very end. And I thought that was so wonderful because I've always thought of it as the goal being a good death. But he's right, the goal is a good life to the very end. So with your continued commitment and hard work, we can help more patients and families reach that goal. And I know what a blessing your care is, not only to the patients, but to their families. What a difference you make. So I am absolutely delighted to receive the Ruby Slipper Award, and I didn't realize it would come with real ruby slippers. And on these very long and difficult days that we are having in Washington, when I get home at night, I'm going to slip in to those ruby slippers, and I'm going to feel your strength sustaining me and lifting me up. So thank you so much. Thank you.